Michael Egan, Egan. My place of business is Echo Hose Ambulance, 100 Meadow Street, Shelton, Connecticut, 06484.
Thank you. You may be seated.
Thank you.
Good morning, sir.
Good morning.
Can you please tell the ladies and gentlemen of the jury what you currently do for a living?
I'm a paramedic with Echo Hose Ambulance in Shelton, Connecticut.
And did you have to go through any training to be a paramedic?
We did. It's a pretty extensive program. It's broken down by didactic, which is classroom, and then a clinical portion. My program was just under 2 years, approximately 1,800 to 2,000 hours.
As a paramedic, are you also an EMT?
You are. I was an EMT first, and then you start as an EMT, and then you can work your way up. And if you choose to go on further, you can become a paramedic.
And what's the difference between being an EMT and a paramedic?
So EMT is considered BLS, which is basic life support. Paramedic would be advanced life support, ALS. On the EMT level, they can do bleeding control, CPR, AED, assist patients with taking some medications, administer a very small amount of medications. Paramedics can do far more. We can go into cardiac monitoring, some invasive procedures. We have a lot larger range of medications that we're allowed to administer. Our scope is just a lot broader than EMTs.
You had mentioned AED with regards to EMTs. What is that?
So that's a defibrillator, an automatic defibrillator. That is where you would apply it to someone who's in cardiac arrest. It analyzes a rhythm and then will determine if the patient should be delivered a shock or not. The machine determines that, not the provider. And that's why EMTs don't have extensive cardiac training like paramedics do. So the machine will determine that for them, or a layperson or anybody who's using it.
And what would a paramedic do in an instance where an AED would be used?
A paramedic, they would be hooked up to their what's commonly referred to as a life pack or a monitor. And the paramedic would be interpreting that rhythm based off their knowledge versus the machine doing it. And the paramedic would make the decision to, if the rhythm had to be shocked or defibrillated, the paramedic would make that decision versus what the machine making that decision.
Now, were you working back on May 15th of 2020?
I was.
And in what capacity were you working?
I was an EMT at that time.
And where were you an EMT?
At Echo Hose Ambulance in Shelton.
EMT, what does that stand for?
Emergency medical technician.
What shift were you working?
I was working 6 p.m. that night until 6 p.m. the next morning. I was on a 24-hour shift.
So you started on the 14th into the 15th?
The night of the incident is when I started at 6 p.m.
And you were slated to get off at 6 a.m. the next?
6 p.m. the day, 24. We call it a reverse 24 because you start later in the day.
Did you have an occasion to respond to a report of medical need at 43 Laurel?
I did.
And I want to direct your attention to State's Exhibit 1 behind you. Is that the area in which you responded?
That is, yes.
What time did you get there?
I believe the call was dispatched just before midnight, and we arrived a minute or two after midnight.
For all intents and purposes, you arrived there on the 15th of May.
Yes, sir.
When you got there, can you describe to the ladies and gentlemen of the jury what the scene was?
So when we arrived, the police were obviously there. I think there was maybe 1 or 2 units. I can't remember specifically. And there was a large group of people on the front lawn. We pulled just past the residence to leave room for additional ambulances because at that point we had been told there was multiple patients. We got out of the ambulance. We were encountered with a very large crowd. It was rather chaotic. People were screaming and yelling. We knew there was possibly four patients at that time, so we started our triage. We came across the first patient. In this picture, if you kind of see, there's a cluster of, looks like kind of garbage. That's right around where we found the first patient. That red tree right there, just in front and to the right of that red tree, we found our first patient. He was laying supine on his back. He was completely unresponsive. His breathing was spontaneous but erratic, which is not a good sign. He had a very weak pulse, which is another bad sign. And he did not look well. You look at someone that's very sick and determine they don't look well. So we do a rapid trauma scan, which is we check for any major bleeding. We did that. I remember his shorts were absolutely saturated in blood. And we found a puncture wound to his upper left abdomen, kind of his left lower chest area. So when we come across a wound like that, where there's suspected trauma, you apply what's called a chest seal. In the event that there is a punctured lung, it can help stop that lung from collapsing any further. So we applied that chest seal. At that point, we didn't see another major bleeding, so my partner broke off and continued to triage the rest of the patients. And when I went to reassess that patient that was laying there, we noted that he had stopped breathing at that point. I reassessed the pulse, and he had no pulse.
But you mentioned triage. What is triage?
Triage is when you get onto a scene and you're overwhelmed by patients for the amount of resources you have immediately available. You have to determine who is in the worst shape and who could benefit most from the help. So if you come across someone that is in cardiac arrest and deceased and you have 4 other patients, you're not stopping to help that patient. Unfortunately, you're moving on to someone who can still be helped. Because if you stop to help that person, their odds are very slim. Now, someone else who had another chance to survive, their odds are going down because you're spending time on this person who really has no shot.
On the night in question, when you got there, is it safe to say, based on what you've told us so far, when you got there, you attended to first patient that you saw?
We did, yep.
And that patient, based on your assessment, was still breathing and had a pulse?
Yeah, it was a very weak, 30 pulse. And his respirations are very, very erratic, but they were spontaneous, so he was still breathing technically.
And,
Yes.
and when you applied the chest seal, I think
Mhm.
you said, what, if anything, did that do for the patient?
I don't believe it did much because when we went to reassess him right after that, he was in cardiac arrest. I don't think it did anything.
When he went into cardiac arrest, what, if anything, did you do next?
When someone goes into cardiac arrest, we immediately apply the AED. The AED will analyze a rhythm. While we're setting up the AED, we'll start CPR. But in a witnessed arrest, you want to get AED on as quick as possible. A witness arrest meaning he went into cardiac arrest right in front of us because odds are he's probably in a rhythm that can be shocked. So we started CPR. I had two bystanders there. One said she was a nurse. One said he was a neighbor that was trained in CPR. Because at this point, my partner was triaging the rest of the patients. So I directed them to start CPR. We applied the AED. You step back and the AED analyzes. It told us that there was no shock advised. And then we retrieved a BVM, which is a bag valve mask. It's called bagging. We applied it to him and we began delivering respirations and CPR in 2-minute cycles.
No shock advised. What does that mean?
So the AED will analyze a number of heart rhythms, but there's only 2 rhythms that you can shock: ventricular tachycardia and ventricular fibrillation. And the AED will only deliver a defibrillation. I'm sorry, fibrillation. I meant to say fibrillation. Atrial fibrillation and ventricular tachycardia. Sorry. Ventricular tachycardia and, sorry, I'm drawing a blank. VFib, ventricular fibrillation. Sorry. Those are the only 2 rhythms that can have a defibrillation delivered to them. So the AED won't deliver a shock to anything else besides that. So when it says no shock advised, it means it wasn't in one of those rhythms. I can't tell you what rhythm it was. It doesn't tell you what it was. It just means it wasn't one of those.
Okay. So when you applied the AED, you received that information. What, if anything, what steps did you take to continue to render aid to that individual?
Sure. So we insert an OPA, which is a small piece of plastic that's curved that helps keep the tongue forward to help deliver ventilations a little more effectively. And then we do CPR at a rate of 30 compressions to 2 ventilations. And we do that in 2-minute cycles. And the AED will count down and it will tell you to stand clear and analyze. We'll analyze, tell you if there's a shock advised, no shock advised. And then you just continue doing that in 2-minute cycles.
What was the scene like around you when this was going on? Do you recall what the scene was like, or were you completely
Yeah, pretty chaotic. There was quite a few people that were screaming, a lot of people in distress. I remember it was dark. One of the police officers was providing light to us with a flashlight. But even then, that wasn't like there 100% of the time. So it was fairly chaotic.
Was it so dark where you couldn't see what you were doing in front of you?
No, I could see what I was doing, but it was dark, but I wouldn't say it was like pitch black where I couldn't see anything. I believe I feel as though there was light coming from the house as well. We have scene lights on the side of our ambulance that we turn on as well, that are kind of like floodlights that provide light. In this case, the ambulance was fairly close to where we were working on this patient.
With regards to stage 5, can you tell where you were working on the patient you just testified to?
Yeah, so there's a cluster of looks like white garbage. Yeah, right there. I'd say it was right in that area because that looks like the remnants of kind of what we leave behind sometimes in emergent situations. A lot of the wrappers of things that we use.
You said you were an EMT back on May 15th of 2022.
Yes.
Did a paramedic arrive to the scene at some point?
He did. I would say just over 5 minutes, anywhere in the 5 to 10 minute range. A paramedic arrived at that point. Our primary paramedics were from a service called BEMS, Valley EMS, and they are out of Seymour. Anytime that there's a call that is considered advanced life support, they will also come in addition to us.
Do you know the name of that individual? That
Jeff McKee.
When Jeff responded to the scene, did he take over care of that patient?
He did. We give a short handoff report of what we encountered, what we've done. He assumes primary patient care.
When you handed off care to Mr. McKee, what, if anything, did you do or did you observe at that point in time?
At that point, I believe we did not spend much time working on him there. We moved him onto the stretcher. We moved the stretcher into the ambulance, and then we started transporting a short time later.
And what were your responsibilities with regards to transport?
During transport, I was driving.
Did you go to the hospital?
Driving, I did, yes.
Okay, and what hospital did you go to?
Bridgeport.
And who was in the ambulance with you while you were driving?
It was Jeff McKee and my partner,
And who was your partner?
Sophia Kaiser.
How long would you say it took to get from 43 Laurel Glen to Bridgeport Hospital?
I can't recall the exact time. I don't want to guess. I can't give you, it's hard for me to give you a number on that.
When you were driving from 43 Laurel Glen over to Bridgeport Hospital, does the ambulance you were driving, does it have lights and sirens on it?
Yes.
Did you, in fact, initiate the light
We do.
sirens? When you get to the hospital, what's the protocol for handing off?
Yeah, so generally at Bridgeport Hospital, we touch base with what's called the EMS triage nurse. She'll check the patient in. You give a handoff report to them, and then they'll assign the patient depending on the acuity of that. Calls like this, we do what's called a radio patch, where you call into the hospital ahead of time and let them know what you're coming in with, and you try to impress on them the seriousness of the situation. So when that happens, a lot of the times you won't stop at EMS triage. You'll bypass them and go directly to the trauma room where the trauma team will be waiting.
And that happened in this case?
It happened in this case, yes.
And once you handed off the patient to the hospital at that point, what What, if anything, did you do in relation to this?
At that point, I just removed the stretcher from the trauma room. We go back to the ambulance and we begin to decon so we can get back in service for if there's any additional calls coming in.
Attorney Smith?
Good morning. How are
Good morning, sir. I'm good. How are you?
you? Talk a little quick, Mr.
I'm sorry. Yeah, I tend to do that.
And so I'm gonna maybe ask you to just slow down a little bit for
my
us.
best.
This one to go over. You used a term right there at the end, which I was unfamiliar with. Maybe the jurors were unfamiliar with as well. You said after you took the stretcher out and went back to
Decontaminate.
you were telling us, Mr. Egan, that you arrived on scene and it was chaotic, correct?
Yes.
In fact, you said people were screaming, correct?
Mhm.
Yelling obscenities, correct? And in fact, yelling obscenities at you and your crew member, Ms.
Yeah.
Kaiser, correct?
Yeah, it happens frequently.
And you said that the crowd was difficult to part to get to the patients. Ultimately, however, you did get to the patients.
We
correct?
did.
And you said one of the patients was standing and able to talk.
I didn't write that in there. I believe Sophia might have written a addendum after she went and triaged, but I did not encounter any standing patients.
You didn't encounter any patients. You encountered one person who was laying down on the grass, correct?
Yes.
And then you rendered some aid to a person that you indicated or believed was the most in need of your care. Is that fair to say?
Yeah, he was the first one we came across. So we do a rapid scan. After we did the rapid scan, applied that chest seal, my partner moved on to assess the rest of them, and then I began working doing the AD CPR.
Any indication that these yelling, screaming folks had been drinking?
I did not witness any alcohol, so I can't comment on that.
Did you feel threatened at all?
I didn't feel threatened. No, I didn't feel the obscenities were being yelled like at us in a violent method. It was more like, hurry the blank up. He's blanking, dying, things like that.
And yet they were still difficult to part for you to get to the patient.
Yeah, because it was very chaotic. So people tend to situations like this. People tend to move in on the patients. You have to be like, hey, excuse me, move out of the way, give us some room.
You mentioned that you parked up to the right of where that bush is on
Yeah.
the exhibit that you were shown. There were cars parked along the roadway.
I can't remember if there were cars parked like directly in front of the house or where they were. To be honest,
Do you recall whether or not there were cars parked in the driveway?
I do not recall. No.
You were solely focused on trying to get to the patient.
Yes.
And when you got to this patient that you had described to us rendering a lot of aid to, you noticed that there was a puncture wound to the left lower chest, correct?
Yeah, left lower chest or upper abdomen, right in that area.
That was the only wound that you saw on this individual that you were treating.
That's the only one I observed at that time. Yes.
And you described that it was rather dark in the area, correct?
Yes, sir.
You said that an officer may have been providing some light to you.
I remember there being a flashlight at one point, but it wasn't consistent the entire time.
You also had a light you described to us that was on your vehicle itself, correct?
The scene lights, yeah.
The scene lights.
Yep.
Those, however, didn't provide a ton of light. Is that fair to say?
No, yeah, it's not adequate by any means to completely light the scene up. No.
And this night was also rainy and misty, was it not?
I don't remember the weather, to be honest with you.
Do you recall whether or not the grass was wet where you were?
I do not.
You said you were the driver, correct?
I was, yep.
Do you recall whether or not you had your wipers on as you were driving to the
I don't recall.
And then you described for us rendering aid. At some point, you were joined by Jeff McKee, correct?
Yes.
You handed off to him. Did he stay in the vehicle with you as you drove to Bridgeport Hospital?
Like, did he stay in the ambulance with us?
Yes.
Yeah, he was in the back working on the patient.
So in this vehicle was you, the patient, Ms. Kaiser, and Mr. McKee.
Yes.
And sir, you've been called here today to tell us what you witnessed when you responded to the scene.
Yes.
You've done that to the best of your ability.
Yes, sir.
But if what these jurors are interested in is why Mr. Valle did what he did that night, you can't really be of any help to these jurors.
No, sir.
Thank you. Nothing further.
All right, sir, you may step down.
Thank
Could
you.
Please watch your step.